welcome. The objective of this training is to provide guidance to New York State VFC providers on best practices for managing vaccine inventory and how to conduct a physical inventory. This training briefly touches on how to use the New York State Immunization Information System, or NYSVFC, to conduct inventory-related activities, but should not be considered comprehensive. NYSVFC offers detailed, in-depth user training separately. Those trainings can be found by visiting the resources document included with these trainings. The primary and backup vaccine coordinators are responsible for managing vaccine inventory. The primary coordinator can take responsibility for all tasks, with the backup providing support in their absence, or the primary and backup coordinators can split or share their tasks. There are multiple tasks related to managing inventory, which include managing inventory in the New York State Immunization Information System, including placing orders for publicly funded vaccine, accepting vaccine deliveries, which involves personally accepting physical shipments, including confirming the viability of the shipped vaccine and appropriately storing the vaccine, rotating vaccine stock weekly, removing expired and spoiled vaccine from storage units immediately, submitting returns and wastage requests, and conducting a physical inventory to compare with NYSVFC's inventory on a monthly basis at a minimum. All VFC providers are required to use NYSVFC to order and track publicly funded vaccine inventory. Each dose that is administered must be documented in NYSVFC. All doses must be entered into NYSVFC within 14 days of vaccine administration, per public health law. Each dose administered will automatically deduct from your inventory in NYSVFC. NYSVFC can interface with a provider's electronic medical record, or EMR, which can transfer a patient's vaccine administration into NYSVFC. Users can also manually enter immunization information into NYSVFC. Be sure to document each patient's VFC eligibility for every administered vaccine. Providers must place and accept VFC orders in NYSVFC. Placing VFC orders in NYSVFC is covered in detail in training number 11 of this series. Accepting orders in NYSVFC is covered in training number 12 of this series. Providers must also use NYSVFC to process returns and wastage transactions for non-viable vaccine. Non-viable refers to vaccine that is no longer usable. This includes vaccine that is expired, spoiled, or wasted. Managing returns and wastage is covered in training number 13 of this series. Primary vaccine coordinators and backup coordinators must accept vaccine deliveries. Coordinators need to personally accept shipments, confirm the viability of the shipped vaccine, and ensure the vaccine's proper storage. Vaccines should only be delivered when the primary or backup coordinator is on duty. The vaccine delivery should never be left unattended and should be unpacked as soon as possible. After the primary vaccine coordinator or backup confirms the delivered vaccine is viable and has appropriately stored the vaccine, they should complete the accept transfer procedure in NYSVFC. Please keep in mind that frozen vaccine ships separately from refrigerated and may not all arrive on the same day. Vaccine stock should be rotated weekly, moving the vaccine with the earliest expiration date to the front of the storage unit. During vaccine rotation, identify any non-viable vaccine. Non-viable vaccine is vaccine that can no longer be used for any reason, including expiration, temperature excursion, damaged or open vials and syringes, and vaccines that were drawn up but not administered. Any non-viable vaccine should be removed from the storage unit and clearly labeled "Do Not Use." If you suspect a temperature excursion, label vaccine in the storage unit "Do Not Use" and complete and submit a temperature excursion report. Do not remove vaccine from the storage unit unless the New York State VFC program has deemed it non-viable. Spoiled and expired vaccine vials and syringes that are unopened should be returned to McKesson, which is CDC's centralized distributor for publicly funded vaccine. Wasted vaccine is vaccine that has been opened or damaged in some way. It is not eligible to be returned and should be discarded. All expired, non-viable, and wasted vaccine must be reported in the NYSVFC Manage Returns and Wastage module. When vaccine is wasted, for example, if it is dropped, broken, or opened but not used, appropriately document and discard the vaccine according to your facility's policies for medical waste disposal, and document all wasted vaccine in the NYSVFC Manage Returns and Wastage module. For internal record keeping, consider maintaining a tally sheet of wasted vaccine on or near the vaccine storage units. This provides an easy record for reporting in NYSVFC. Submit returns and wastage transactions in NYSVFC regularly to account for any expired, spoiled, or wasted vaccine. Wastage transactions can be submitted on an as-needed basis. Conduct a physical inventory of VFC vaccine at least monthly. This can be done at the same time as your weekly vaccine stock rotation. Always conduct an inventory check prior to placing an order in NYSVFC. The number of physical vaccine doses in your storage units and the number of vaccine doses in NYSVFC inventory should match. Based on the doses on hand shown in NYSVFC, your orders may be reduced or denied. The next few slides will explain how to properly conduct a physical inventory of your vaccine supply. Prior to conducting a physical inventory, ensure your refrigerator and freezer units are properly set up. To reduce the chance of a temperature excursion during an inventory check, consider breaking the inventory into smaller sections to lessen the time that the door stays open. For example, inventory 1 shelf per hour, closing the door in between. If an excursion occurs, keep the storage unit door closed, continue to monitor the temperature closely, and complete and submit Part 1 of the temperature excursion report immediately to vaccine-temp-excursion@health.ny.gov. To conduct a physical inventory, print a copy of your current inventory in NYSVFC. You must have administrative user role in NYSVFC to access the Manage Inventory feature. Click on Manage Inventory, then select the radio button for Non-Expired on the main Manage Inventory page. For more information on managing inventory in NYSVFC, see Chapter 9 of the NYSVFC User Manual, found on the resources document included with these trainings. Compare the physical inventory in the vaccine storage units with the inventory information on the NYSVFC inventory printout. Confirm that the vaccine is publicly funded before removing the vaccine from the storage unit. Ideally, publicly funded vaccine should be stored on a different shelf than privately purchased vaccine. Remove all doses of the first trade name of the vaccine you are checking and close the storage unit door. The NYSVFC inventory sheet displays inventory alphabetically by trade name. The trade name for each vaccine product is located on the box. Group the vaccine by lot number. The lot numbers for each vaccine are located on the box. For each trade name and lot number, count the number of individual doses in each box of vaccine. If the vial caps are all the same color, then each one is 1 dose. If the vial caps are different color, then it takes 1 of each color to make 1 total dose. If the box contains vials and syringes, then it takes 1 of each to make 1 dose. If the vaccine comes in a multi-dose vial, and marks have been made on the vial, you can subtract the marks from the total number of doses that the vial started with, which results in the number of doses remaining in the vial. Compare physical inventory to the NYSVFC inventory sheet printed out in Step 2. Note any discrepancies between your physical inventory and your NYSVFC inventory, and remove any expired vaccine that you find in the storage unit. Reconciling inventory in NYSVFC involves accounting for non-viable or wasted vaccine. Submit a return wastage request in NYSVFC for any non-viable vaccines. Once the request has been approved by the VFC program, your NYSVFC inventory will automatically deduct. Other factors besides returns and wastage can impact inventory quantities. If your practice interfaces with NYSVFC via an EMR or data exchange, and there are issues with the file transfer process, inventory may not decrement properly. Check the Inventory Not Deducted module in NYSVFC to identify any possible data exchange discrepancies. Contact NYSVFC directly for assistance with any data exchange issues. In certain circumstances, the New York State VFC program will allow providers to borrow vaccine from their public stock for private use. These circumstances can include a delayed vaccine shipment, vaccine that was spoiled in transit, or ordering time that was calculated incorrectly. These should be rare events, and borrowing requires prior approval from the New York State VFC program. The borrowing request form can be found in the VFC program Forms and Resources section of the New York State VFC program website, and also linked on the resources document included with this training. The New York State VFC program has a vaccine restitution policy that requires vaccine providers to provide financial restitution in situations which publicly funded vaccine is deemed non-viable due to provider negligence. The restitution policy depends on the size of the eligible patient population. VFC practices with standard population size of eligible patient populations greater than 50 are allowed a 5% annual allowance towards wasted vaccine. VFC practices with smaller population size of eligible patient populations less than 50 have an annual wastage threshold of 10%. Seasonal flu vaccine and any vaccine purchased as part of an outbreak response will not be counted as part of the annual wastage. The allowance is based on the total doses of vaccine wasted compared to the total doses of vaccine ordered in the practice's previous 12-month period. Providers who lose vaccine due to uncontrollable circumstances, such as power outages or unforeseen equipment failure, will not have those losses counted against their wastage allowance. Examples of restitution scenarios are included in the table on this slide. Possible restitution scenarios may include having an excess of expired non-flu vaccine or over-ordering non-flu vaccine, vaccine loss due to inappropriate storage and handling equipment, or vaccine loss due to staff negligence, for example, adjustment of the thermostat incorrectly or failure to monitor temperatures. Scenarios that are not considered for restitution include having too much expired flu vaccine or over-ordering flu vaccine, or vaccine loss due to power outage that occurred when the office was closed or equipment failure with no previous signs of a problem. To increase vaccine utilization and reduce waste, use as much of the vaccine as you can before it expires. Run a reminder recall report in NYSVFC to identify patients who are due or past due for immunizations. NYSVFC trainings provide tutorials on the reminder recall tool. If more than 10 doses of vaccine are about to expire, transfer vaccine to another enrolled VFC provider that will be able to use it. If your office is part of a larger parent organization, contact the parent organization to see if any other sites within the organization can use the vaccine. If there is another VFC provider nearby, check with this provider to see if they can use the vaccine, and ask the county health department if they can use the vaccine or if they can assist you in finding a provider that can use it. To transfer vaccine, providers must obtain prior approval from the New York State VFC program. Transfers must adhere to transport protocols, and providers should complete a transport tracking sheet. Information and instructions on transporting vaccine is covered in more detail in training number 9 of this training series. If you have less than 10 doses of vaccine or you are unable to locate another provider who can use the excess vaccine, you must waste the vaccine as explained in slide 6 of this training. As referenced earlier in this training, the Inventory Not Deducted module is used to view a listing of immunizations added to NYSVFC through the data exchange process that did not deduct from NYSVFC's inventory. This option allows you to deduct the immunization from your NYSVFC inventory by assigning the correct trade name and vaccine lot to the listed immunizations. Please see the New York State Department of Health website for detailed training on the Inventory Not Deducted module and other NYSVFC trainings. The key messages for this training module include the following. The primary vaccine coordinator and backup coordinator are responsible for the following vaccine inventory activities. Manage inventory in the New York State Immunization Information System, including placing orders for publicly funded vaccine. Accept vaccine deliveries, which involves personally accepting physical shipments, including confirming the viability of the shipped vaccine and appropriately storing the vaccine, rotating vaccine stock weekly, removing expired and spoiled vaccine from the storage units immediately and submitting returns and wastage requests, conducting a physical inventory and comparing with NYSVFC's inventory at least monthly, and using recommended best practices to increase vaccine utilization and reduce vaccine wastage. Thank you for your participation in this training on managing vaccine inventory. Any questions can be sent to NYVFC@health.ny.gov.